Welcome to the Higher Power Podcast, presented by Higher Power Sports PT, the show dedicated to helping active individuals like you unlock your full potential through expert insights on injury prevention, performance enhancement, and recovery. Kurt Kessler is a board-certified specialist in sports physical therapy and an athletic trainer. In each episode, he and his guests bring you the latest evidence-based strategies to help you move better, feel stronger, and stay injury-free. Let's learn together.
Hey there, everybody. Welcome to another episode of the Higher Powered Podcast. Full transparency, I recorded this episode originally about 8 weeks ago, and when I was preparing it to be released this week, I didn't feel like it properly conveyed the message that I was trying to send in the original recording. I didn't send the right message to the audience, other providers, or even myself. So I'm doing this again with a fresh perspective in hopes of making it a better show for those who are listening. Today, we are going to talk about some different models in the physical therapy business, what they offer to patients, and who might be best suited for each setting. Then, on the next episode, I will dive a little bit deeper into my philosophy, what exactly my business offers, and what I'm trying to accomplish for my patients. I'm excited to release the episodes where I have guests join me, but I need to lay this foundation first. So the topic we're going to discuss today is comparing physical therapy that utilizes insurance versus the out-of-network cash-based model. Now, I am a little biased because my practice is cash-based, and I decided to go that route based on extensive research that I've done, but I will highlight the landscape of each one. Let's look at the insurance physical therapy model. PT companies negotiate rates with insurance companies for payment or reimbursement of physical therapy services. The patient pays a copay, and the insurance pays for the rest. What a lot of patients don't know or don't see is that insurance companies over the last 10 to 15 years continue to decrease what they're willing to reimburse PT companies for their services. For example, 15 years ago, the average reimbursement rate for a single physical therapy session was roughly $140. Now, insurance companies have cut reimbursement to the point where it is now roughly $100 per visit. In order for traditional insurance physical therapy model to make as much money as they did 15 years ago, they now need to see more patients to make up for that $40 deficit that they're facing with every visit. And that is just to get back to where they were 15 years ago. That's not adjusted for inflation, not adjusted for cost of living, not adjusted for increase in salaries, which in the physical therapy profession, we are amongst the lowest salary professionals with doctorate degrees. Like I said, the only way to offset that is to see more patients. The industry standard across the board is usually 55 to 60 patients per week per therapist. I have seen clinics and have friends that work in clinics that see 70, 80, 90 per week. So for this reason, when you're a patient in the insurance PT clinics, you are typically paired with 1 to 3 other patients depending on the schedule, the individual clinician, overlapping visits, etc. So if time is evenly distributed amongst patients, you are typically getting somewhere between 10 and 30 minutes of the PT's attention. Now, I have been in these situations where sometimes someone is coming in and feels good. They might have gotten 5 or 10 minutes of my attention, while others come in a lot more pain or during a flare-up and require a lot more attention. When I was in that setting, these situations made me feel really stressed, made me feel guilty, and very frustrated. And because of all these hoops that insurance PTs have to jump through, there is more documentation required now than ever in order to justify insurance companies authorizing visits. So with all this documentation, you have two choices. You either put it off so that you can give everyone in front of you super max attention and then have to stay after work by an hour, or take your computer home and finish your notes at home and extend your workday, Or you can document efficiently while the patient is in front of you, but that might take just a few more minutes that the PT is devoting to documentation instead of patient care. And you're typically going 2 to 3 times a week in this setting. There have been some smaller PT companies popping up with a new model that offers one-on-one visits that last about 45 minutes. I would say even with the reduced visit time, these are probably more effective and more efficient models in terms of patient care and patient results. They still have the challenges of justifying and obtaining insurance authorization. They still face visit limits from insurance and all the other factors that come along with accepting insurance. In the cash-based physical therapy model, you are receiving one-on-one care, typically for an hour. There's a lot more personalized connection between the provider and the patient, and even between the patient and their own rehab process. The great thing about this model is that you can really make it whatever the patient needs. If they need it 3 times a week, you can do that. If they need once a week, you can do that. If they need once a month, you can do that as well. There are no restraints in tailoring it to be exactly what you, the patient, need. There are some therapists that utilize a mobile clinic, meaning they travel to your home, they travel to your gym, they travel to your workplace or wherever. It's just really awesome because there are no limitations on the experience that the patient and the provider can have. The next topic to touch on here is the financial aspect. There's going to be a lot of numbers thrown around here, and I will try my best to keep this very clear and concise to help you follow along. There is a big misconception out there that cash-based physical therapy is much more expensive than physical therapy that utilizes insurance. And it does appear that way at quick glance, but let's dive in just a little further and see what you're actually paying for. First, there are a wide range of factors that influence the cost of care. Deductibles for insurance, copays. So there's a lot of variability to what I'm about to talk about. We will just go with the averages. The average deductible for insurance plans falls in the range of $1,900 to $3,900. The average copay is around $40, but can range anywhere from like $10 to $100. If you have a $40 copay and you're spending 15 minutes in direct care with your PT, you are paying $2.67 per minute with your physical therapist. If you're spending 10 minutes in direct care with your physical therapist, you are paying $4 per minute with them. The rest of your time is spent running through exercises under the supervision of an unlicensed professional, often a PT tech who is usually a high school or college kid with little or no training in exercise. And just a quick disclaimer, there are some really, really good techs out there, and that position is really important to get young kids experience. I worked as a tech when I was in high school and in college, but I recently worked with a tech who really knew my brain as well as I did and would be able to ask the questions and gather information that I would look for. She was an incredible help to me, but sometimes you can get in the ethical weeds because only a physical therapist should be changing exercises or evaluating the response to exercises. And we did a pretty good job of staying on the same page, but I know that that's not the case everywhere. There are often times where the physical therapist will just do the hands-on portion, and then the unlicensed tech will just run through the rest of the exercise with the patient. Now, shifting gears to cash-based rates can vary greatly by location or provider. Again, we'll go with the averages. At $100 per visit under the care of a PT for 60 minutes, you're paying $1.66 per PT minute. If you bump that up to $150 per session, you're paying $2.50 per PT minute. So $1.66 to $2.50 per minute in cash versus $2.67 to $4 per minute with insurance. Again, there are a lot of variables. Some days you might get more time, some days you might get less time with your PT. At these clinics that see 70, 80, 90 a week, your value starts to go way down. And you might think, Well, what's the difference if I spend 15 minutes or 60 minutes with my PT? The difference is that when you're handed off to an unlicensed tech, there is no more input, decision making, or feedback that happens. There are usually no adjustments, and they might not even be checking your form. A good PT will be looking to make sure that the desired effect of exercise is happening. Therefore, you get like 4 times more of the attention that will actually help make you better, and no restrictions from insurance. I'm going to try to not get stuck in the weeds here because, like I said, it is a highly variable situation based on the numerous insurance factors. But from a total cost perspective, with a deductible, you are paying all of that first before insurance will cover a dime. An example of this, a few years ago, my wife needed PT after she had our first child. She went to PT for 5 visits, and we ended up paying $2,000 out of pocket. Big old bill came to us like weeks after she finished. Ended up being like $400 a visit. We could have saved like $1,500 by going cash-based. Now, I realize those examples are extreme and not the norm. So if you take deductibles out of it, the average plan of care of insurance PT typically lasts 12 to 15 visits. That range is like $300 to $750 for total plan of care utilizing insurance. That same plan of care likely ends up being 6 to 8 visits in cash-based PT. It ends up landing in the $600 to $1,000 range in half the visits and no hoops to jump through. Now, the last thing we're going to talk about today is an article by Find a Movement Pro. And it's titled 6 Reasons You Should Ditch Your Insurance for PT and Chiropractic for Your Recovery. Number 1, patient satisfaction and personalized care. Roughly 94% of patients report higher satisfaction due to more personalized care, one-on-one attention, and tailored treatment plans. In the traditional outpatient setting that utilizes insurance, roughly 30% of your visit time is spent in direct care with a PT. And then you spend more time with unlicensed personnel and multiple providers. So one thing that the insurance PTs will try to do is keep patients with the same provider, but because of the volume, because of the variability of, everybody that's coming in, patients might end up with multiple providers, and that can decrease efficiency in a lot of cases. Second point, roughly 25 to 40% fewer visits are needed and roughly 25 to 40% quicker recovery times. More efficient care, less time and insurance constraints, and roughly 75% of patients in cash base reach their rehab goals faster. This is due to the ability to customize, the time to think, time to assess, and you just end up with less cookie cutter programs due to lower volume. The next point is wait times and access. So in cash-based therapy, oftentimes you can get same day or next day appointments. According to this article, traditional outpatient wait times are 7 to 10 days. I will say that this is a focus of the insurance PT clinics. They're trying to create an edge on their competition by prioritizing quick access. So, for example, the company that I worked for, we would leave evaluation spots open so that patients who call in to schedule an appointment would have options within the first 2 days of calling. Now, I will say that this is great because oftentimes the quicker a patient can get into PT, the quicker they can get better. But I will also say that this can really be a headache for the providers because what happens is you block that spot waiting for someone to call in and schedule. So what you have to do is double, triple, quadruple book above and below that spot, and it ends up it just ended up being a headache for myself, and I know a lot of other PTs in that situation. The next point here, clinician workload and burnout. according to this article, traditional outpatient therapy, they're seeing up to 16 to 20 per day. I know in a lot of clinics, the standard is about 12 per day. But, again, in these clinics I see 70, 80, 90, up to 100 patients in a week, you're getting into that 16 to 20 per day range. And even with a great provider, your time together is still going to be limited, which is a recurring theme in all of this. Cash PT, PT with a full caseload is seeing roughly 6 to 8 per day. And the last point here, cost effectiveness. Like I said, it seems more expensive up front because of the higher pay per single session, or if you're buying packages, paying for total visits up front. But with increased efficiency, you're having lower total visits and you're getting faster recovery. And they estimate roughly 10 to 15% less in total costs. So the question is, who is each setting right for? I'm making the argument in favor for cash-based because the vast majority of people don't even know this is an option. The article done by Find a Movement Pro highlights the value of cash-based and really presents a nice option for potential patients to consider. There are two groups of people that would benefit greatly from cash-based PT. Individuals with high insurance deductibles, like this scenario I described with my wife, and those who are without insurance or solo entrepreneurs, because without insurance, you're going to pay the PT company the cash rate of roughly $110 a visit anyways, so you might as well get one-on-one care and far fewer visits out of it. On the next episode of the Higher Powered Podcast, I told you I'm going to take a deeper dive into my philosophy and what I'm doing with my practice. That is an episode where I will make a strong argument for who would benefit from different types of PT services. The key in all of this is getting people to the correct providers so that they can get the best care as efficiently as possible. After that episode, I'm going to start releasing the episodes with my guests because you'll be sick of hearing from me by that point. That's going to do it for today's episode. Thank you again to everyone for listening. I hope this was helpful in just presenting maybe some new information or a new way to consider physical therapy services. If you have any questions or want to connect, you can always find my information in the show notes, and we will see you next time.
That's a wrap for today's episode of the Higher Powered Podcast, presented by Higher Powered Sports PT. We hope you gained valuable insights on how to stay strong, move better, and prevent injury, all backed by expert knowledge in sports physical therapy and athletic training. If you enjoyed today's episode, don't forget to subscribe, rate, and review. Your support helps us bring more evidence-based tips and strategies to active individuals just like you. For more resources or to connect with us, head over to hpsportspt.com. That's hpsportspt.com. Remember, you've got the power to perform at your best. Keep training smarter, recovering faster, and living stronger. Just a reminder that the content shared in this podcast is for informational and entertainment purposes only. It should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your health or treatment plan. Thanks for tuning in. We hope to see you next time on the Higher Powered Podcast.